Hi, everyone. My name is Stacey Adelman, and I'm a registered psychologist here in Regina, Saskatchewan, and I own the Joshua Tree Learning Center. And we've been trying to go every week for Tuesdays at 12. That's becoming a little bit challenging. We might have to make this every second week on Tuesdays, as life has been getting pretty busy, as I'm sure it has been busy for all of you out there. However, check back every second Tuesday and we will jump online and we talk about a variety of different topics. Today, I really wanted to talk about psychoeducational assessment because this is a frequent question we get here at the office. When do I seek out a psychoeducational assessment for my child or for my teen? And so what I tell people is essentially, we're wanting us to look at a psychoeducational assessment as what we typically call it like a tier 3 intervention. So when we work in the schools, or when I was working in the school system, we have different levels of interventions for individuals or for kids that might be struggling in different kinds of subject areas. And so what that means is there's a lot of different strategies and things that we want to try first before we jump into a psychoeducational assessment. So an assessment is really quite robust. It's going to give a lot of information. It takes quite a bit of time, a lot of effort. And we just want to make sure that we've done all of the other things first before we dive into an assessment to get that additional information. And so typically what we want to see is perhaps, the individual that is needing the assessment perhaps is continuing to struggle in various different subject areas, or it could be just in one subject area. It wouldn't be uncommon, for example, for an individual to be doing okay in math, but really struggling in reading, or vice versa. Maybe they're doing good in all the other subject areas, but math continues to be just a really significant struggle. And so they're continuing to struggle despite having various interventions. So maybe at the school level, they have a record of adaptations. What's being done in the classroom already? Are they receiving additional supports? Now, I understand those additional supports may not always be accessed at the school, so we're certainly aware of that due to a variety of different issues. But it's a good question to ask. Are they, in a learning resource program, or are they getting specialized support with the reading or the writing or the math or what have you? Are they maybe accessing, getting extra support through a tutor or some other outside agency, and we just aren't seeing the growth that we would expect given that level of intervention? So that's a really key part in determining whether or not we want to move forward with a psychoeducational assessment. Are there different kinds of mood issues that are occurring? Are we seeing anxiety? Are we seeing depression, right? Are we seeing difficulties with attention and focus? Is this continuously coming up maybe at school and at home? Are we seeing it in different settings? To what degree is it affecting the individual or causing impairment in their day-to-day living? These are all questions that we need to talk about and kind of figure out before we dive into a psychoeducational assessment. Age, typically we can assess at different ages. They can be quite young when they assess. When we're looking at things like attention and focus, I'm really cautious about that. I do like to give kids time to grow and develop. We do know that from part of the brain, where they learn those executive functioning skills like focus and attention, for example, we know that that's the last part of the brain to develop. And we know that kids develop at different rates. That being said, I wouldn't say we don't assess, but we certainly want to be aware of it, and we would have that conversation with you. Typically, when we see kids that are struggling at school, maybe in reading, they might be struggling with things like blending or identifying their sounds, or maybe if the writing, maybe they aren't getting the sound or the letter written on the page, so they're not getting the corresponding letter with the sound, or vice versa. Maybe there's difficulties with fluency and pulling all those reading processes together. Maybe there's difficulties with reading comprehension. Those are typical areas in reading we might be looking at, but most often, are they struggling, particularly with phonics? We tend to see a lot of weaknesses in that arena. Are they really struggling with math? Are they, able to apply the skills of math in a problem-solving kind of way? Are they struggling, with math fluency, remembering their math facts and things like that? Or in writing, are they having trouble getting their thoughts and ideas down? Maybe persistent difficulties with spelling is something to certainly be aware of and take note of. And so those are all areas at school that if they continue to struggle and we're just not seeing growth despite intervention, then it might be worth it to come in and have a conversation about what could be contributing to these difficulties. In terms of attention and focus, are they there's different kinds of ADHD, right? When that might be a topic for another Tuesday at 12. But do they have difficulty focusing and attending? Are they frequently losing things, difficulty with time, impulsive perhaps? Not all kids with ADHD are impulsive, so that's certainly something to be aware of, and we'll talk more about that. But those are just some of the common characteristics that might be flagged with our children that, we might want to look at a psychoeducational assessment. So how can a psycho-ed assessment be helpful? Well, it gives us information about the root cause of these behaviors or these difficulties. So sometimes, yes, extra practice can help, and we certainly want to be aware of that. But if the extra practice isn't helping, that tells us there's something going on. There's a different root cause as to why they're experiencing difficulty in those subject areas. We typically look specifically at reading, writing, and math. So we want to figure out the why. Why are they struggling here? And what do we need to be doing differently in order to support them academically, and then also support them at home, and then as they grow and develop into their older years. So a psychoeducational assessment can be really helpful in documenting perhaps a history of learning difficulties, which is important. As kids get older into their teen years and beyond, it becomes really important for programming and then providing accommodations in the school system, but also in the workplace and in their post-secondary experiences as well. So it can give us a lot of really valuable information. It can also really help us look at some of the emotion and the mood issues that might be occurring too. Again, if despite interventions for things like anxiety or depression, and we're just not seeing improvement, we can dive into an assessment and figure out why. Why are they continuing to struggle despite the intervention? So that's something to really keep in mind. If you have questions about a psychoeducational assessment, please let us know. We want to hear your questions, and I always say parents know their kids extremely well, more than I do, and then any of us do when we're providing that assessment. So we're here to listen to you, and we want to together, collaboratively work together to create the best plan moving forward for your child. So please give us a call at 306-546-5674. Our intake coordinator works really closely with you to find the best fit clinician to work with you and your child and your family. And then from there, your clinician or your psychologist, when it comes to assessment, it's our psychologists that do that work. Your psychologist will sit down with you and get all of the pertinent background information, will listen to all of your concerns, and together with you, we'll discuss whether a psychoeducational assessment is in fact appropriate at that time, if there's other things we want to do instead before we dive into that. And then we'll create a full plan moving forward with you. So don't ever hesitate. If it's something you're thinking about or wondering about, we're here to help guide you through that process. We can explain all the pros and cons with you, and together we'll make a decision on the best way to move forward. Thanks everyone for taking time to meet with us today. And I'm going to say this time, let's see you in 2 weeks on Tuesday at 12. Take care and have a good one.